President Biden is said to be improving as his battle with COVID enters a third day. The president's physician says his symptoms are waning after a full day of treatment with the antiviral drug Paxlovid and Tylenol. Noticeably hoarse, the president joined a virtual meeting on gas prices Friday. Dr. Kevin O'Connor says the 79-year-old president, who is vaccinated and boosted, has a normal pulse, blood pressure, respiratory rate, and oxygen saturation. He did stop short of providing specific metrics. For more on the president's condition and the state of the pandemic in the country, we are joined now by the president's chief medical advisor, Dr. Anthony Fauci. Dr. Fauci, I want to start with the president. There are two things there. We've also seen him working masked and unmasked. So a question about maybe the messaging that we're seeing with the masking, and what more can you tell us, if anything, about the president's condition?
Well, first of all, the president is doing really quite well. I had a long conversation last night at around 10 o'clock with Dr. Kevin O'Connor, who's the primary physician for the president, and the president continues to improve. He's putting in a full day of work virtually, and as each day goes by, he's doing fine. So, as we've said before, given the fact that he's been vaccinated, doubly boosted, and is receiving Paxlovid, a drug which clearly goes a long way to preventing progression of disease, we fully expect that he's going to be doing very well. With regard to masking, when the president is in the presence of people who are doing things around him, for one reason or other, he'll put a mask on. When you see him without a mask, then he's following the CDC recommendations.
So we're seeing this spike in these Omicron subvariants, BA4, BA5. If this is what we're going to be seeing as our big summer COVID wave, what can we expect?
Well, it's very difficult to predict. One of the things that we're obviously seeing is that we're averaging around reported about 140,000 cases, which is likely a rather significant undercount. It's probably several-fold more than that because many people get infected, have mild to moderate symptoms, and don't report it. The thing we're concerned about is that hospitalizations are going up. We're having about 40,000 people in the hospital, and we're still at around 300 to 400 deaths. That's something that is a level that is really not acceptable. So before talking about additional spikes, we need to be concerned about and do something about what's going on right now is an uptick in cases. We've got to get a better control of that, and we have ways of doing that. People need to get vaccinated. People who are up for their booster should get boosted. When you're in an indoor setting and in a location, a jurisdiction that has a high level of viral dynamics, you should be wearing a mask indoors. Those are the kind of things we can do to prevent even more of an uptick in cases than we're seeing right now.
Dr. Fauci, it does seem like a lot of people right now are treating this like a cold. Not one you want to get, but you get sniffles for a couple days, you feel tired, then you're better. Not everyone, of course, but that does seem to be the way a lot of people feel about this right now. Is that the right or wrong approach? And then what are you expecting in the fall?
You know, I believe ultimately we're not going to eliminate or eradicate this virus. We're going to have to live with it because it's the virus that has such a degree of transmissibility that it's not going to just disappear. However, we are not at that point now when you have 40,000 people in the hospital, you have hundreds of thousands of people getting infected, and you have 300 to 400 deaths. We're going to get to a point where we'll have to go along and not have this disrupt the social order. But it is premature to think we don't have a problem to deal with. Because although we'd like the virus to be behind us in the rearview mirror, as we say, the virus is not acting that way right now. And we can do something about that. As I just mentioned, there are things we can do to bring down that level. So although we would all like to be free of the virus, we're not free of it yet. We're going to have to learn to live with it. But we've got to do better than we're doing right now.
An ever-changing virus, and it is our new normal. Dr. Anthony Fauci, thank you so much.